It was happened in my second placement in my first year. I was allocated into gastrointestinal ward in hospital. I feel more confident to work here than my first placement because I did a variety of the pre-work before I attend this placement. Like the typical reason for a patient to be admitted to the ward, common medication used in this ward. Encouraged by my facilitator and body nurse, I had confidence to perform the clinical assessment independently, for example, the A2G assessment. One day, a 45-year-old female presented to ward with appendicitis. The patient has history of the breast cancer. And the routine of the ward, we need to check the vital signs of the patient 3 times in every shift. So I brought a machine to bedside to check this data. In order to avoid any mistake, I had a look around the patient room to ensure if there are any signs, like the precaution. Patient looks more settled under pain relief than she just arrived in. I started to check the vital signs after I received the oral consent from her. All the vital signs are between flag except the blood pressure. I found the machine took a long time to measure blood pressure, and the result was so strange. It is 20/64. I was so nervous because that's my first time to see the blood pressure like that. And then I asked the patient how's the feeling due to the blood pressure. She said much better, and she does not believe her blood pressure is lower like that. And then I went to use the manual sphygmomanometer to check it again, and I did not get the results finally due to the strange noise. Next, I went to my body nurse to report this situation immediately. After I ensured the patient is settled by patient talking and observing, my nurse was shocked too. She went to bedside soon to ensure the patient is safe, and then looked through the patient's document. She told me, patient has history of the mastectomy on left side, so we cannot take the blood pressure on this arm. It is better to choose another arm or lower limb. There should be put a sign on the wall to remind staff check the blood pressure on right arm, and you also need to improve your knowledge related with that, and then make appropriate clinic judgment, not always follow the routine. After that, I realized that I need to improve in variety aspect related with clinic, especially my critical thinking, as well as my clinical knowledge. As a nurse, I should have a critical thinking based on wealth of the knowledge and experience before every therapeutic practice, rather than following the routine blindly. This experience impacted me a lot. I think it is important to fully understand the situation and the information of the patient, and it will help me to build a critical clinical judgment, even there is no reminder to follow.